Hello and welcome to the Ross Cloud Podcast. I'm your host, Carl Ross Sr. And this platform was created to motivate and to inspire in hopes that you will become a better you. I'd like to give a shout out to everybody that's listening all over the world. Thank you guys for tuning in to the Ross Cloud Podcast. And today is our healing session with Miss Beth Kincaid. How are you, Beth?
Good. I hope you are.
Yes. I'm doing much better now. What you got for us, Beth?
I wanted to talk today about chronic pain and dealing with that, and that kind of turned into, like it usually does, more than that one thing.
Yeah, it's true.
Because I couldn't really talk about chronic pain without talking about chronic illness, which turns into something else.
Yeah.
And the things that come from that get triggered by that.
Yes.
And the people that are helping people that are going through those things. So talking about the caregivers as well.
Oh, I love that. Yes.
So the more I got to thinking about chronic pain, and we think about what causes that. So those things that might cause that would be migraines, diabetes, heart disease, arthritis, kidney disease, HIV, AIDS, lupus, MS, general back pain, fibromyalgia, amyotrophic lateral sclerosis, which is actually Lou Gehrig's disease. Some people have something called trigeminal neuralgia, which is intense head pain.
Yeah.
That you can't find the cause for or fix, really. Sickle cell anemia is another one that I think causes people pain.
Yes.
And so when you think about those things, just as an example, because there's a lot more, I started thinking about, well, people that get up every morning who are depressed, or they have autism, or they have a developmental disorder, or something that just affects them in general every single day of their life.
Yes.
I started thinking about young women and middle-aged women who still are going through menstruation, and some people have a really hard time with that, causing severe pain that some go to the hospital for because they have polycystic situations that are exploding inside of them that are very painful.
Yes.
And people that have this pain that have to wake up every morning not knowing what the day is going to be like, and so they can't really plan for anything. And they don't know how long it's going to go on for. There is kind of no end date.
Yeah.
And so Alzheimer's, dementia, that's another mental health issue that people have that gets worse and worse as you go along. Some people that have thyroid issues that affect people's energy levels and that kind of thing.
Yes.
Allergies and actually addiction issues. This is another one that, you know, that affects everybody on a daily basis that is involved in those issues.
Yes.
So for millions of people, those chronic illnesses and depressions are facts of life. They last a very long time. That's why it's called chronic. And usually can't be cured completely, although some of them can be controlled or managed by a lifestyle, diet, exercise, or medications. Many people that have those illnesses become depressed, so that depression is one of the most common complications of a chronic illness. It's estimated that up to 1/3 of people with a serious medical condition have symptoms of depression. And it's really not hard to see why. One of the things that affects that is sometimes people aren't diagnosed as children, and they may have one of those illnesses as a child. But the doctor might feel it's just growing pains or overreactions to things, and so they don't do any diagnostic testing. And then as they get older, they may get a diagnosis that they weren't expecting, or maybe they were expecting it. And sometimes they still don't get an answer. So if you don't know still what's going on, that feels pretty hopeless.
Yeah.
And if somebody tells you you're going to have to live with this for the rest of your life, that gets pretty hopeless as well.
Yes.
So you have this thing you're dealing with the thought of persistent suffering in your life and changing the quality of your life and causing you to be dependent on other people, that's pretty scary.
Yeah.
And makes you think of your own mortality.
Yes.
The stress that causes exacerbates what you're already feeling.
Mm-hmm.
And then you have generally a lot of people, especially my sister has MS. She's in one of those situations right now. It was a fast, rapidly moving one that took her down relatively quickly. So she can't walk now. She really can't dress herself. She can't live by herself, essentially. So she has this boyfriend that does that.
Okay.
Which is nice that he's there for her.
Yeah, that is.
But a lot of times what happens, and I've worked with clients who have this situation going on, and their spouse or their partner is there to help them, but after a while they just feel like a caregiver. It becomes not a very romantic thing, and so you really have to work on nurturing that relationship and how to keep that going.
Yeah.
So it affects not just your physical self, your emotional self, but it also affects your work, your family, your school life, your friends, your recreational activities that you may not be able to do anymore, as well as your self-esteem. And so people start to feel lost and they're not really sure who they are anymore. Mm-hmm. So just getting that definition of who am I and the grief that they feel over who they were is really sad and hard. So it can really eat away at your self-confidence and your sense of hope in the future. So part of what we look for hope is what do we like to do? What can we do for fun?
Yeah.
And how often can we do that?
Yeah.
Because we really need something to look forward to. So in a study that was done by the Centers for Disease Control and Prevention in 2020, they found that 20.4% of adults that were living with chronic pain in 2019 were feeling some mental health issues. And 7.4% of adults that had chronic pain frequently had to limit their life and work activities. So that affected their depression levels and that kind of thing. So chronic illness and depression get higher depending on the severity of the illness and the level of disruption it causes to your life. Mm-hmm. The risk of depression between men and women, actually women are at 10 to 25% risk according to this research, and 5 to 12% of men are at risk for depression.
Yeah.
I don't know. I always wonder in these reports how much of that is the person's self-report, because it could be that more women would be likely to report or acknowledge that than men.
I agree. Mm-hmm.
Again, some of these illnesses may affect more of one sex or gender than the other.
Yes.
So that may skew those statistics. Risk is especially high in someone who has a history of depression. So if you were depressed before your chronic disease started, then it's obviously going to get worse.
Yes, yes.
Especially if the illness causes pain and fatigue and it limits your ability to interact with other people. It can cause the depression can also cause itself to intensify the pain or the fatigue or the sluggishness. So the combination of those might lead you to isolate yourself and make it even worse. It's kind of that cycle that feeds off each other. Mm-hmm. So research on chronic illnesses and depression indicates that depression rates are high, often among those with chronic conditions. So I was looking at statistics of those that have heart attack or have had a heart attack.
Yeah. Of
those people, 40 to 65% experience depression.
Wow.
That's a large number.
Yeah, it is.
Coronary artery disease without a heart attack, 18 to 20% experience depression. Parkinson's disease, 40% experience depression.
Wow.
Multiple sclerosis, 40% experience depression. Mm-hmm. Stroke, 10 to 27% experience depression. Cancer, 25% experience depression. Diabetes, 25% experience depression. And chronic pain syndrome, 30 to 54% experience depression.
Wow. Do you think those numbers are a little higher, Beth, maybe? Do you think they could be higher?
Are they higher than what they're saying?
Than what they're saying?
Yeah. So I was just about to say.
Okay.
There's another study that I looked at that said of those who took Mental Health America screenings in one study, and I feel like those are things you go to the doctor for your issue, and they ask you to take this screening to see if you're getting depressed or if you are depressed.
Got you.
Of the people in this particular study that took panic attacks, and probably more than that, so the symptoms that you get as a result of the depression, part of the problem sometimes is those people with chronic illness, as well as their family members, often overlook those symptoms of depression because they assume that it's normal with that condition that you have to feel sad if you're struggling with that disease. And the symptoms of the depression might also be masked by other medical problems. So if the symptoms get treated, but not the underlying depression, then if you have both of them, you really need to treat them both at the same time because they're both going to cause an issue. So some of those things might be sleep problems. Depression can affect your body as well as your mind. And so trouble falling asleep or staying asleep is common with people who are depressed. Some might find they get too much sleep, and some might find they aren't getting enough sleep. And so their sleep cycle kind of gets messed up. Chest pain can be a sign of heart, lung, or stomach problems, so it's important to see your doctor to rule out those and whether that's what it is, whether it's actually a physical thing like a heart issue or if it's the depression. So sometimes that can be a symptom of depression as well. If you get a panic attack, a lot of times people feel like they're having a heart attack. So depression can also raise your risk of heart disease, and people who have had heart attacks are more likely to be depressed. So again, they kind of commingle in there.
That's right.
Fatigue and exhaustion. If you feel so tired you don't have energy for everyday tasks, even when you sleep or rest a lot, it may be a sign that you're depressed. If you have a hard time getting out of bed and being motivated to do anything, that generally is an indicator of that.
That's true.
And together, depression and fatigue can tend to make both conditions seem worse. Actually, depression medications have been known to help with pain management. I guess because I think they give you more energy to be able to deal with that effect on your body. So aching muscles and joints when you live with ongoing pain, that can raise your risk of depression. Depression may also lead to pain because those two conditions share the same chemical messengers in your brain. Who knew that? People who are depressed are 3 times more likely to get regular pain. Digestive problems, our brains and digestive systems are strongly connected, which is why many of us get stomach aches or nausea when we're stressed or worried. Bowel issues, oh my gosh, there's so many people I know with that because those are people that hold their stress in their stomach. And they worry. Sometimes when people get anxious, they like to focus on the physical so they don't have to focus on the anxiety.
True.
So then they start to become obsessive with that. And that just, again, is a cycle that feeds off each other. So depression can get you in your gut, too, causing nausea, indigestion, diarrhea, or constipation. And then you start taking medicines that really aren't helpful, and so that kind of feeds into that as well.
Makes it worse, I guess you could say.
So you take one for constipation, and then that leads to diarrhea, so you take that Imodium or whatever, which stops you up, and it's just this constant cycle that just keeps going. Headaches. One study shows that people with major depression are 3 times more likely to have migraines, and people with migraines are 5 times more likely to get depressed. And yes, that is one of those things that actually could be in that list of chronic illnesses that cause pain and depression. Epilepsy is one I think I left out. That's something that certainly can cause people to be depressed because you're not allowed to do a lot of the things you might normally be able to do with that diagnosis. Changes in your appetite or your weight. Some people feel less hungry when they get depressed. Other people can't stop eating. The result can be weight gain or loss along with lack of energy. Depression has been linked to eating disorders like bulimia, anorexia, or binge eating. Back pain, when your back hurts on a regular basis, it may contribute to depression.
Yeah.
But it also causes you to not be able to do your work duties.
Yeah, that's true.
And if you feel like it's never going to stop, it's kind of hard to know where to go from there or how to plan your life.
Yeah.
So people who are depressed may be 4 times more likely to get intense, disabling neck or back pain. Why would you imagine that would be?
I don't know. I guess, you know, I guess you would think it would be something that would you just become numb.
It can cause that, but at the same time, it causes your muscles to tense.
That makes sense.
And all of our muscles are connected to each other.
That's right.
So if you're going to massage your hand, you really need to massage your wrist and your arm all the way up to your elbow, your shoulder, and then up your shoulder blade to your neck, all the way around your head, because it's all connected. So a lot of times we get those tension headaches because we're just constantly walking around
like that.
Yeah, a ball of tension.
Wow, so massages are necessary.
Massages are important. It's also important to stop about every hour or so and stretch your muscles so that you can have them loose enough to tell when they're starting to tense so you can loosen them. Because a lot of times we walk around all tense and we can't even feel it when we're tensing because we just stay that way.
Oh, that's so true.
And we hold our breath, which causes us to hyperventilate and have panic attacks. And so it's important to do your deep breathing about every hour as well. At the same time, just a few minutes to take a few deep breaths and stretch and relax. And remind yourself to be where you are.
Yeah, it's good stuff.
So agitation and restlessness, sleep problems, or other depression symptoms can make you feel agitated or restless. This study says men are more likely than women to be irritable when they're depressed. I don't know why that would be, because I know a lot of women get irritated when they're depressed or restless.
Right.
I feel like pain and depression can also overstimulate your system, and so when you become overstimulated, some people shut down, other people get irritated, and they lash out.
Yeah.
Because they can't get away. So when you can't get away, your fight response comes out. And you just want the stimulation to stop. Really.
Yeah.
Sexual problems. If you're depressed, you might lose interest in sex or physical intimacy. Some prescription drugs that treat depression can also take away your sex drive and affect your performance, which creates depression. Yeah. So you can talk to your doctor about medicine options. Exercise research suggests that if you do exercise regularly, it releases chemicals in your brain, those endorphins, that make you feel good and improve your mood and reduce your sensitivity to pain. Although physical activity alone won't cure your depression, it helps to ease it over the long term. Yes. And it may make you feel stronger to help you feel like you have more energy to deal with those things. If you're depressed, it sometimes can be hard to get the energy to exercise, but try to remember it can ease fatigue and help you sleep better. What I tell people is if you feel like you can't exercise, then stretch. That actually does a lot of the same things as regular exercise. Correct. It's a step. Yeah. So depression is treated much in the same way for somebody who's chronically ill as for somebody who isn't. Early diagnosis and treatment can ease distress along with the risk of complications and suicidal ideation. Many times depression treatment can improve your overall medical condition, a better quality of life, and a greater likelihood of sticking to that long-term treatment plan. When depressive symptoms are related to physical illness or the side effects of a medication, your doctor might need to adjust or change that treatment around depending on what's going on, which can fluctuate. Yes. The weather, there's a lot of different things that can affect your chronic pain and that kind of thing. Oh, yeah. More than 80% of people with depression can be treated successfully with medicine, psychotherapy, or a combination of both. Antidepressant drugs usually take effect within a matter of weeks, And you should work closely with your doctor or psychiatrist to find that most effective medication.
Yeah.
I am fully aware that that's a hard thing to do for people because it's all kind of a guesswork game.
Yeah, it is.
Unfortunately, they do.
They have so many, you have the medical marijuana industry now that's booming. You have the cannabis industry that's booming right now as it pertains to that, too.
So that brings up something I did want to bring up.
Okay, cool.
There is
I wanted to ask you anyway.
There's an unfortunate side to that right now.
Okay.
In that the people that are trying to get their pain management done here with doctors or different clinics, and even in the pharmacies, they're now on this list of people that are not, they need to be watched if they're taking pain medicine because they're taking too much or they're at risk of manipulating the system and trying to go to more than one doctor to get their pain managed. Mm-hmm. And I have found it recently to be really difficult for these people that are going through that because a lot of these pharmacies right now are running out of certain products there. And you have to shop around and find it yourself for one thing. I have one client who has managed her pain that has been chronic for a long time. Fibromyalgia is one of those things that kind of crosses over with other things.
Yes.
And so she's managed it by smoking pot like maybe once a day.
Okay.
Maybe twice.
Mm-hmm.
But now her pain management clinic is telling her she has to quit that. And every time she goes there, they take a urine sample so they can tell whether or not she's doing it or not.
Right.
Because the pain management clinic is afraid the FDA is going to come and close them down.
Okay, understood.
And so the marijuana people, the medical marijuana people that are here trying to push that to get those laws to get passed, it has been passed through the Senate, but not through the House yet.
Correct.
The House was supposed to, this past Wednesday, have a discussion about it. I haven't heard what they talked about.
Me either. I haven't heard.
They also have been planning, apparently, for all of those stores or the people to process the manufacturing of those drugs or the marijuana legally.
Yes.
That was supposed to be set up to start, I think, at the end of this year, but they're setting it up to start for next year. Okay. So there's some assumption along the way, I think, that the way they manage those manufacturers, it's well managed. It's over managed. And so there should not be any kind of problems with that.
Yeah, it shouldn't be.
And they're all lined up to go next year, but we'll see what happens. We don't know. So until then, we have this group of people that are trying to manage their pain. I've got another one who has that trigeminal neuralgia and other pain.
Sure.
She has a list of things. And she cannot stand to move from her bed.
Ooh.
These people are also thinking about assisted suicide at some point if they can't get their pain managed. So, because they can't do anything. But she found if she doubled her pain medicine that she's on right now, that actually gave her some relief.
Wow.
So she's going to talk to her doctor about that. But what happens if the doctor says, I'm sorry, I can't.
You can't do it.
It's counterindicated. I can't prescribe you that. You know, it almost seems like, so that forces them to maybe have to move to another place where it can be acceptable.
Yeah.
And I think we really do need to move towards a different kind of way of dealing with that particular issue. So hopefully eventually that will happen.
Mm-hmm.
So depression, disability, and chronic illness form a vicious cycle that can bring on these bouts of depression and get in the way of successfully treating that. It's a very big challenge to live with it, and it's normal to feel grief and sadness as you come to grips with your condition and its implications. But if they don't go away and you're having trouble sleeping or eating, or you've lost interest in your activities, things you can do to avoid depression are to not isolate yourself. Try to reach out to family and friends. If you don't have a solid support system, take steps to try to build one. That is going to be really hard if you're in a lot of pain. So you can ask your doctor or your therapist about support groups or other community resources. You can look for them online to see if there's a group you can talk to there. Mm-hmm. Learn as much as you can about your condition, because knowledge is power when it comes to getting the best treatment available and keeping your sense of independence and control, and see what other people are doing that are working. Mm-hmm. Make sure you have medical support from experts you trust and can talk openly about your ongoing questions and concerns. And if you don't like your doctor and they're not helping you, I would strongly recommend you go and find one that you do
Absolutely.
like. Make sure that you have that medical support with the people that you trust, like I just said, and you can feel comfortable asking them openly about what your concerns are.
Yes.
If you suspect that your medication is bringing you down, talk to your doctor about that and other possible treatments. Talk to your doctor about pain management. As much as possible, keep doing the things you like to do and try to stay connected, not only with others, but with yourself, so you can boost your own self-confidence and sense of community. So if you think you're depressed, don't wait to get help. Go and find a therapist you can trust.
Yes.
There's one other issue I did want to bring up about that.
Sure.
This article I was looking at talked about a topic I think is really important related to that, and it's called ableism. So there really are a lot of doctors out there who are supporting, I think, the idea of how able you are. It's a systemic kind of oppression. And that can also cause psychological distress among people that have these conditions. Mm-hmm. So we're living in an oppressive society where ableism, as well as racism, sexism, homophobia, transphobia, other biases, are commonplace and make people with chronic conditions and disabilities susceptible to that same bias and harmful stereotypes.
Wow.
So if somebody sees somebody coming along with a wheelchair or in a wheelchair, they may automatically assume they are incapable or they can't hear, and they start talking loud, but they can hear just fine.
Right.
You know, and so it manifests itself in many ways, and it exists in every different level of society that there is. And it may be that belief system is a well-meaning person that wants to help you, but you really don't need for them to do that. So it passes on kind of harmful messages, even if it's subconscious to people in that group.
Yeah.
So a person with ableist beliefs may believe that disability accommodations are a privilege and not a right, that the presence of chronic illnesses and disabilities make that person less than a non-disabled person. And there are a lot of people that get mad at people that have their little disability wheelchair handicap sticker in their car.
Yeah.
And they say it's not fair, but they really don't understand what that person is going through.
True.
So anti-bullying, violence, those are things that the society really should be working on as forms of ableism. There's hostile ableism. Openly aggressive behaviors. You know, people feel that people that with disabilities are weak, and so they may not want to hire them.
Right.
And they feel like they need to be rescued, and that can undermine their autonomy. Ambivalent ableism is a combination of two other forms and manifests when a person treats someone with a disability or chronic condition in a patronizing way that switches to being hostile when the person living with the chronic illness or disability rejects unsolicited advice or help.
Wow. So it's a thin line.
There's a thin line.
Wow.
Ableism affects people differently depending on how other people perceive their condition or disability. So some people discriminate against those with visible chronic illnesses and disabilities differently than people that have invisible chronic abilities and disabilities.
Wow.
So again, with your sign that's hanging in your handicap sign in the window, and they see people getting out of the car, walking what they think is just fine. They don't understand. They may have something to do with their breathing. or any other kind of thing
Right.
that you don't know about.
And that's a valid point. I'm glad you brought that up too, Beth.
Another situation is people that with invisible chronic health conditions are often asked to legitimize or prove
Wow.
that they actually have that condition.
Wow.
And they're told they might be exaggerating or lazy, particularly if they're in a relapse or remission. And so for those with obvious physical disabilities, they may be asked to legitimize their disabilities. It still happens, but it might be less often than the others.
Right.
People do. So a lot of times doctors feel like people are faking things to get pain medicines or to scam the doctors. And so once you have that reputation, that's affecting another one of my clients who doesn't want to go to the doctor because every time she goes, she feels like she's being treated like somebody that's in there trying to take advantage of the system.
Gotcha.
So the other things to focus on that can help, putting myself in somebody's shoes that has all that physical pain, because I've gone through back pain for a short period of time.
Sure.
And that trigeminal thing, I experienced that, which really turned out to be a root canal issue. But those things really, if I had to experience that all day, every day, I would really have a hard time with that.
Sure.
So I'm very extremely grateful that I don't have to do that right this instant.
Yeah, that's right.
But DBT therapy is something that can help, and ACT therapy, which has to do really with focusing on being in the moment you're in and trying not to judge it, trying not to anticipate it.
Yeah.
You just live in that moment and trying to focus on what works and what you can look at or listen to or whatever it might be to help you feel some relief.
Yes.
Or to help you to reduce the intensity of what you're feeling. It also helps you to detach yourself from your thoughts and feelings and know that that pain or that illness it's not you.
Yeah.
The feelings and the thought attached to it is not you.
Yeah.
So you can create whatever you want to help you to cope with these things.
Yeah.
It's just a long haul to do it.
Yeah.
And I just see every day as a work in progress for everybody until you're not here anymore. So
that's right.
That's all you can do. I would hate if I was in that situation to commit suicide if next year somebody kind of discovered a cure for that.
Yeah.
And then you could have had a lot more better quality of life.
Absolutely.
For years to come.
Yeah. That's so true.
Yeah. So you want to try to separate yourself and learn how to regulate your emotions and kind of become more in touch with that so you can catch it when it's not to the extreme.
Yeah.
And try to really be honest with yourself about what works and what doesn't work.
Yeah. That's a good point. Yep.
Yeah. Be kind to yourself and try to shift your focus to something else so that your brain is kind of distracted by what's not working. And you want to know what's important and what's not to focus on so you can commit yourself to that.
Yeah.
So the last thing that I would say is this sign above you that says never give up.
Yeah. That's true. Beth, thank you so much. Thank you so much for this. I hope you guys have heard something today that can help you become better. And there's a key word that Beth said on today: be kind to yourself and never give up. I love it. Thank you so much, Beth. We really do appreciate it. Listen, this is the Ross Cloud Podcast. You can follow us at the Ross Cloud Podcast 7722 on YouTube. You can check us out on Facebook at the Ross Cloud Podcast. You also can follow us at on YouTube at Mixed Network Ross Cloud Podcast on YouTube as well. And you can check out some of the great visuals that we have. Listen, this is the Ross Cloud Podcast. Make it a great day. I'm Chris Ross. Peace.